Hi, I'm Leah
And I'm Jessica.
from Channel 5 News, and today's story, teen pregnancy. Teen pregnancy and childbearing in the United States have continued their decline over the past 2 decades to historic lows. 57.4 pregnancies and 24.2 births per 1,000 female teens aged 15 to 19 years. This sounds like great news, but does not account for the disparities among African American teen pregnancy rates. Youth residing in out-of-home care are 2.5 times more likely to become pregnant by age 19, and more than 1.5 times more likely to experience a repeat pregnancy than those in the general population. This statistic shows another problem with teen pregnancy: the prevalence of repeat births accounting for more than 1/6 of births to adolescent mothers. This is a problem in our city, but a more extreme study done in Horry County has found that the teen pregnancy rate for African American teens is 42.8 births per 1,000 females, which is well above the national average of 26.6 births per 1,000 females. Now you might be wondering, but why is this happening? Why is there such a high rate of teen pregnancy among African American teens? Well, approximately 18% of the residents in Horry County live below federal poverty level, and the unemployment rate hovers around 10%. Other factors that influence these rates include the source and accessibility of sex education, where, among 8 focus groups of youth, teens most often reported parents, other trusted relatives, and the internet as sources of sex health information, as well as attitudes about contraception that differ among racial and ethnic groups. Among those who report having sex, a higher percentage of African American youth, as compared to white youth, report not using contraception at the first and the last time they had sex. Contraception misinformation stemming from culturally based health myths and unequal access to health care information is more common among African American women. Now, for the impact in our own community, to you, Madeline.
I am here at the local high school talking about the issue of teen pregnancy with a student who is working to lower this rate. What have you noticed about the teen pregnancy rate?
Well, I've noticed that about 1 in every 10 girls around school are pregnant.
Well, that seems like a lot of girls. Have you noticed any differences in race specifically?
I'd say that less than half the girls are white.
Well, what about the rest of them?
Most of them are African American, and there's a decent amount of Latinas as well.
So, in this high school, the teen pregnancy rates are pretty close to those of the rest of the country. Are you working to lower this rate at all?
Yeah, the school has implemented new methods to continue to lower the teen pregnancy rate.
Well, we will hear more about that when we come back. Back to you in the studio, Jessica.
Thanks, Madeline. Here's more news on teen pregnancy today. Can the U.S. end teen pregnancy?
So right now, teen birth rates are already really low, but there are still a few things that states can do to reduce their rates even further. The teen birth rate is at 24.2 births per 1,000 women in the age group of 15 to 19-year-olds, down 9% from 2013. And that's the lowest among that age group since they started keeping track in 1940. But as of 2011, the U.S. still had the highest teen pregnancy rate among 21 similar countries. The evidence is mostly anecdotal, but there are a couple of reasons why these countries have lower teen pregnancy rates. One thing is they just have more widely accessible birth control pills. One of the factors is also income inequality. But there's also different attitudes about teen sex. So in the Netherlands, the teen birth rate is several times lower than it is in the US. American parents tend to fear teen sexuality, while Dutch parents have a more accepting attitude. Something that the researcher Amy Chalet found was that Dutch parents say something like, "We permit it so that we can control it." Teenagers there are more likely to have sex for the first time at home, with their parents knowing about it, and they're also more likely to use condoms their first time. Teen pregnancy rates in general tend to be lower in the Northeast and higher in the South and Southwest. Poverty, culture, religion, and other factors are associated with those rates, but that doesn't mean states can't change their fate. So in the early 90s, for example, California had one of the worst teen birth rates in the nation, but it reduced it by 60% by promoting comprehensive and medically accurate sex ed in schools. And it also reached out to teens and parents of the community with sexual health information. Only 24 states mandate teaching sex ed. The percentage of schools teaching sex ed across a range of topics has actually declined in recent years. Only 18 states require kids to get information about contraceptives. What doesn't work is telling kids to pledge to be abstinent until marriage. That works fine if the teens are extremely religious, but if they're not, they end up breaking their pledges. And because they never learned about condoms or birth control, they're more likely to get pregnant or get STDs than if they had never pledged to begin with. And some studies show that states that emphasize abstinence have higher teen pregnancy rates and birth rates. And teens who receive comprehensive sex ed, in one study, were 60% less likely to get pregnant. Sex ed is just the start, but it's a good start.
Here are the facts. We know that abstinence does not work unless the teenagers that promise to wait are very religious. Otherwise, many of these teenagers break their pledge. If these teenagers do not receive proper information about contraceptive methods, such as condoms or birth control, they are more prone to becoming pregnant or contracting STDs. The states that emphasize abstinence have higher teen pregnancy rates and birth rates. However, the states that had sex education and contraceptive talks were 60% less likely to get pregnant. In order to decrease teen pregnancy, implementation of sex education across more schools is the answer.
We're back at a local high school with Claire, a student here. Now Claire was telling us about health promotion methods her school is putting into action to help lower the teen pregnancy rate here.
Yeah, in our school, the teen pregnancy rate is relatively high, so we've started to do more to try to lower it. Right now, I'm putting up posters around the school, like these ones, that have statistics on them as well as methods of contraception.
You also mentioned the school is adding more to the required health classes about teen pregnancy. What are they adding specifically?
Well, we're talking about teen pregnancy more, and they include a lot more about contraception, including online games that help show students how easy it can be to get pregnant.
In this high school's required health classes, students are now playing computer games to learn about teen pregnancy. These games are designed to demonstrate to students that it is easy to get pregnant. In this game, called Birth Control Brigade, students place different methods of birth control along the map and wait as 5 waves of sperm go through. You can add and adjust the strengths of several methods of birth control and add them multiple times, which is not necessarily realistic, but it gets the point across. The different methods of birth control also need to be replenished throughout the game, or they will diminish and no longer be effective. The game demonstrates to the students playing that even when using birth control, you can still get pregnant. In the game, if you make it through all 5 waves without losing all 20 lives, or letting 20 sperm through in this case, you can move on to the next stage. When you lose all 20 lives, you cannot continue to the next stage and end up pregnant, like demonstrated here. This game is called Dodge the Sperm. This game demonstrates to students how easy it is to get pregnant and just how many chances you have to get pregnant when not using birth control.
Well, that's all we have today. Back to you in the studio.
Thanks, Madeline. According to Charlotte T. Galloway's Exploring African American and Latino Teens' Perception of Contraception and Access to Reproductive Healthcare Services, we must also ensure that teens' beliefs and perceptions are taken into account, especially when developing, marketing, and implementing culturally competent reproductive healthcare services. By doing so, there will be an improvement of access to care for all teens, regardless of their race. That's all for today's segment on
Teen pregnancy. Stay safe.